Burning sensation in the lower abdomen, causes and symptoms. People who experience a burning sensation in the lower abdomen may have a condition of the urological, gynecological, or digestive system. Causes of a burning sensation in the lower abdomen may include gastroesophageal reflux disease or GERD, peptic ulcer disease PUD, kidney stones, certain gynecological conditions, and cancer. People should note that a burning sensation in the lower abdomen is not common. It is more common in the upper abdomen, where the pain is usually associated with gastroesophageal reflux disease or peptic ulcer disease. A burning sensation in the lower abdomen often comes with urination, which means that it may be a urinary tract infection or UTI. However, a UTI may not present with any abdominal pain. For females, there are multiple gynecological conditions associated with lower abdominal pain that might feel similar to burning. There are other conditions that could be associated with a burning sensation in the lower abdomen. People should talk with a doctor about their symptoms. Keep watching to learn more about the possible causes of a burning sensation in the lower abdomen, including any associated symptoms and how to treat them. Gastroesophageal reflux disease. A burning sensation in the abdomen may be a symptom of gastroesophageal reflux disease, which is a chronic condition affecting the digestive system. It is one of the most common digestive conditions in the United States. Doctors can identify certain risk factors for developing gastroesophageal reflux disease. For example, some people have motor anomalies that affect the movements of the esophagus. This can affect the ability of the esophagus to clear its contents. Another possible risk factor is dysfunction of the lower esophageal sphincter, which can allow acidic stomach contents to rise up through the esophagus. Symptoms. Aside from a burning sensation in the abdomen, people with gastroesophageal reflux disease may experience heartburn, regurgitation, chest pain, dental erosions, chronic cough, laryngitis, asthma. Treatment. Doctors may recommend several strategies to treat gastroesophageal reflux disease, including certain lifestyle changes, medications, surgery, and endoluminal therapy. They may first recommend the following self-care strategies: losing weight for people with overweight or obesity, not eating 3 hours before lying down, elevating the head end of the bed, stopping smoking or not starting, not wearing tight clothing that puts pressure on the abdomen. It may also help to avoid the following potential trigger items, though the research into the effectiveness of avoiding them is limited: chocolate, caffeine, spicy foods, citrus fruits, mint, fatty foods, carbonated beverages. Instead, a doctor may simply advise a person to avoid foods and beverages that they know worsen their symptoms. Some medications that can help treat gastroesophageal reflux disease include histamine blockers and proton pump inhibitors. For people with severe symptoms that do not respond to the above self-care strategies or medications, surgery or endoluminal therapy may be necessary. Peptic ulcer disease. People with peptic ulcer disease may also experience a burning sensation in the abdomen. Doctors will diagnose peptic ulcer disease when the inner lining of the stomach, small intestine, or lower esophagus becomes compromised by stomach acid secretions or pepsin. This is an enzyme that breaks down protein. Doctors have identified several factors that may cause peptic ulcer disease, including Helicobacter pylori infection, use of non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen, use of other medications such as corticosteroids. Smoking may also play a role in intestinal ulcers, while alcohol consumption can irritate the stomach and promote gastric acid release into the stomach. Symptoms. People with peptic ulcer disease experience upper abdominal pain right below the ribs about 15 to 13 minutes after eating a meal. If the person has an ulcer in the small intestine, the pain may only begin 2 to 3 hours after a meal. Some other signs and symptoms of peptic ulcer disease include bloating, abdominal fullness, nausea and vomiting, weight loss or weight gain, vomiting blood in the stool. The following warning signs require immediate emergency care and a consultation with a gastroenterologist. Unintentional weight loss, progressive difficulty swallowing, bleeding in the digestive tract, iron deficiency anemia, recurrent vomiting, a family history of upper gastrointestinal tumors. Treatment. Doctors will treat peptic ulcer disease with medications or surgery. If a person tests positive for H. pylori infection, they may require antibiotics. People whose conditions do not respond to this protocol may require a quadruple therapy with bismuth and different antibiotics. If possible, some doctors may recommend that people stop taking medications that contribute to peptic ulcer disease. However, people should not stop taking any medications without first seeking the advice of a doctor. People with refractory disease that does not respond to medication may require surgery. Kidney stones. People develop kidney stones when a crystal, usually comprising calcium, travels from the kidney through the urinary tract. Kidney stones do not always cause problems and health complications, but some can get stuck and lead to medical issues. Some risk factors for kidney stones include a personal history of kidney stones, a family history of kidney stones, increased absorption of oxalate through the intestine, UTIs, low fluid intake, a history of diabetes, obesity, gout or hypertension, acidic urine. Symptoms. People with kidney stones may not experience any symptoms. The most common symptom of kidney stones is a sharp pain radiating to the groin when the stone begins traveling down the ureter. People may describe this pain as dull, sharp or severe. Some individuals may feel nauseous or vomit because of the pain. Blood in the urine is also common. Some people may also report a burning sensation when urinating. Treatment. Doctors may need to prescribe pain relief medications. Since passing a kidney stone is often very painful, people may also take non-steroidal anti-inflammatory drugs to help with pain. Increasing fluid intake is also important. If a doctor finds a kidney stone that is 6 millimeters or larger, they may need to intervene to manually remove it from the urinary tract. Urinary tract infections or UTIs. UTIs are bacterial infections of the urinary bladder. Doctors categorize UTIs as either complicated or uncomplicated. An uncomplicated UTI occurs in people who are otherwise healthy and not pregnant. Symptoms. People with a UTI may experience painful urination or a burning sensation while urinating, frequent urination, pain or tenderness below the belly button, blood in the urine. People who are very young or old may experience subtle or unusual symptoms. For example, older adults with a UTI may present with confusion or an altered mental state. The symptoms of a complicated UTI are usually similar to those of an uncomplicated UTI. Treatment. Doctors treat UTIs with antibiotics. To select the most appropriate antibiotic to treat the infection, the doctor will consider the person's risk factors for infection with a pathogen that is resistant to multiple drugs. Gynecological conditions. Different gynecological conditions can cause pain in the lower abdomen that might feel like a burning sensation. These conditions may include a ruptured cyst, painful menstruation, endometriosis, pelvic inflammatory disease. During ovulation, a fluid-filled sac or cyst may form on an ovary. Most are benign, but they can sometimes rupture and require intervention. Painful menstruation or dysmenorrhea refers to pain during menstruation without a disease of the pelvis. Sometimes other conditions can cause painful periods. Endometriosis is a chronic condition of the female reproductive system wherein the tissue that normally lines the uterus grows in other parts of the abdomen. Symptoms. The following table lists some of the symptoms associated with ruptured cysts, painful menstruation and endometriosis. You can see the table in the screen. Treatment. Depending on the diagnosis of a burning sensation in the lower abdomen with a gynecological cause, a doctor will select the most appropriate treatment. The following table lists some treatment options for causes of a burning sensation in the lower abdomen. You can see this table in the screen. Cancers of the digestive, urological, and gynecological tracts. Certain cancers of the digestive, urological, and gynecological tracts may present with pain in the lower abdomen. Depending on the type of cancer, people may experience different symptoms. However, the condition may also go unnoticed. Although cancer is more common in older adults, anyone with troubling symptoms should arrange an evaluation by a doctor.